Medications. There are different types of medications used for acute respiratory distress syndrome. These are benzodiazepines, general anesthesia, corticosteroids, opioid analgesics, neuromuscular blocking agents, and antibiotics. Benzodiazepines such as lorazepam and midazolam reduces clients' anxiety and resistance to ventilation and decreases oxygen consumption. Some of the nursing considerations would be to monitor the respiration on clients who are not ventilated and monitor their blood pressure and oxygen saturation. It's also important to note to use it cautiously in conjunction with opioids. General anesthesia, like propofol. It induces and maintains anesthesia. It sedates a client who are to be placed in mechanical ventilation. Nursing considerations would be to keep in mind that it is contraindicated for clients who have hyperlipidemia and egg allergies. Also, administer only to clients who are intubated and ventilated. Monitor clients' ECG, BP, hypotension, and sedation levels. And IV rates must be slowed to assess neurological status. It's also important to monitor for pain and administer analgesics as prescribed. Next is corticosteroids such as cortisone acetate, methylprednisolone sodium succinate, and dexamethasone sodium phosphate. This medication reduces white blood cell migration, decreases inflammation, and helps stabilize the alveolar capillary membrane during ARDS. Some of the nursing considerations would be to discontinue medication gradually, administer with an anti-ulcer medication to prevent peptic ulcer formation, monitor weight and BP, glucose, and electrolytes. Also advise the client to take oral doses with food and avoid stopping the medication suddenly. Opioid analgesics, such as morphine sulfate and fentanyl. It is used to provide pain management for the client. Nursing considerations would be monitor respirations for clients who are not ventilated, monitor BP, heart rate, oxygen saturation, and ABGs, because hypercapnia can result from depressed respirations. It is also used cautiously in conjunction with hypnotic sedatives, and it's important to assess pain level and response to medication after it's given. Have naloxone and resuscitation equipment available for severe respiratory depression in clients who are not receiving ventilation. Neuromuscular blocking agents, vecuronium. Its action is it facilitates ventilation and decreases oxygen consumption. Often it is used with painful ventilatory modes such as inverse ratio ventilations and PEEP. Nursing considerations: administer only to clients who are intubated and ventilated. Monitor ECG, BP, and muscle strength. Give pain medication and sedatives with neuromuscular blocking agents because neuromuscular blocking agents do not sedate or relieve pain. Therefore, client can be awake and frightened. Have neostigmine and atropine available to reverse the effects of neuromuscular blocking agent. Have resuscitation equipment available, and reassure the client that paralysis is medication-induced, and explain all the procedures. Antibiotics such as vancomycin. This is used to treat identified organisms. Nursing considerations would be to culture sputum prior to administration of first dose, monitor hypersensitivity reaction, give IV dose slowly over at least 60 minutes to avoid Redman syndrome, monitor the IV site for infiltration, and do not give with other medication. It is also important to monitor coagulopathy, and renal function, and advise client to take oral doses with food and finish prescribed